Hi everyone, Dr Clarke here, and welcome back to my channel. Today we're going to talk through a really common CASC scenario which has been coming up time and time again in the exams recently. It centres around explaining transference to a patient who is looking to terminate psychotherapy. Examiners want to see whether you can explain transference in a clear, structured way that a patient understands while also showing empathy and good communication skills. In this video, I'll show you exactly how to do that in a way that is sure to gain you top marks and help you pass this tricky station. Hi William, thank you for coming in today. My name's Dr Clarke and I'm one of the psychiatrists. Your care coordinator asked me to speak with you today as I understand that you're thinking about ending your therapy early. Is that right? I'd really like to explore all of the possible reasons around this with you so that we can then think together about what might be the best plan moving forwards. Does that sound okay with you? I do really appreciate you coming in to talk with me about this. I recognise that it might feel quite personal and difficult to discuss. Could you please tell me what type of therapy it is you've been receiving? Could you try and explain to me the reasons why you are thinking of stopping therapy? It sounds like you've been feeling even lower since starting therapy, and that makes you wonder whether it's even worth continuing. That's actually a really common worry, and lots of people find things get harder before they get easier. There are lots of reasons people might think about ending therapy. I could categorise these into factors relating to yourself, factors relating to the therapist, and then factors relating to the therapy relationship itself. I will explore these in more detail with you now, if that's okay. Great. Please let me know if you think any of these might fit with what's happening for you. Firstly, as a patient, you might feel that the therapy is no longer required as you're feeling better now. You might have got a new job and not have time for the therapy anymore, or you may have moved to a new area. Does any of that apply to you? Secondly, the therapist might have moved away or be turning up to the appointments late. You might believe that they are incompetent or that they have broken your trust and confidentiality in some way. Have you found any of those to be true with your therapist? Sometimes in therapy, people notice strong or difficult feelings arise towards their therapist. It's actually a normal part of the process, and there's a name for the experience. It's called transference. Have you ever come across this idea before? Transference is when someone unconsciously transfers or redirects feelings from other important people in their past or present, like parents or partners, onto a current relationship, like with their therapist. These feelings can be positive or negative, and they're not really about the therapist themselves, but about experiences in other relationships. For example, if you had felt repeatedly let down by people when you were younger, you might start to feel that your therapist doesn't care and will inevitably let you down too. Does that make sense? Thinking about it now, have you noticed any similarities between how you feel about your therapist and how you felt about other people in your life? Importantly, transference isn't a mistake or something to ignore or avoid. It's actually a vital part of the work. Noticing transference in therapy can give you the chance to understand and work through unresolved emotional issues from your past. Does that make sense? It sounds a bit like you're considering ending therapy before it can even really help, almost as if leaving first might protect you from being let down. I think it could be really helpful to bring these exact feelings into your next session so you and your therapist can explore them together. How does that sound to you? In summary, these feelings which you've experienced about your therapist are really important and not something we should ignore. They're actually part of the therapy process and what the work is meant to address. Rather than stopping now, I'd really encourage you to take these feelings to your next session and talk them through directly with your therapist. From what I understand, you've been engaging well and there's still every reason to expect therapy can help you. How does that sound to you? In this CASC station, a strong closing shows empathy, encourages the patient to stay engaged with therapy, and demonstrates you've reframed transference positively. It also reassures the examiner that you've stayed focused on the task and achieved the station's goals. Remember to chunk and check your explanations and try to stay calm, friendly, and approachable throughout. If you practice explaining transference using the structure in this video, you'll feel confident and prepared if or when this station comes up in your real exam. Thanks for watching. If you found this video useful, then please give it a like, subscribe to my channel, and drop a comment down below to let me know which CASC station you'd like me to tackle next. I'd love to hear your suggestions.